Well, the cold weather and today's snowfall can make for some dangerous combinations for our heart health. Dr. Shoba is here now with some valuable information for this time of year. And Dr. Shoba, it's always great to have you back on the show.
Good morning.
Very timely topic as the snow continues to fall out there. Jeremy was talking earlier about how this is going to be enough accumulation. We might need to do some shoveling.
That's right. I skidded my way in here and I realized one thing. When it comes to slopes and the snow, I am not a good driver.
Pumping your brakes, right?
That's
Being
right.
extra careful. And of course, that's what people need to be doing when they're out in these conditions because we're not used to the cold and the
That's
snow.
right. And that is problem especially in our parts where we don't get snow that often. And we are not very physically active. So take this 50-year-old guy who likes to smoke a little, you know, is a little bit overweight, has some risk factors for heart disease, has a little diabetes. He doesn't do work, you know, much of the year, and then comes snow time. There he is picking up the shovel and taking big chunks of snow, trying to shovel the driveway early in the morning, trying to get to work. Stress, number one. Physical activity that he's not used to, number two, can actually precipitate a heart attack. In fact, we see a lot of admissions right around Thanksgiving to February, around January is actually we see a lot of heart attacks and heart trouble and a lot of admissions for this reason as well. So I think you need to keep yourself hydrated.
Okay.
Try not to push big chunks of snow with your shovel. Use a smaller shovel.
Okay.
Dress warmly. The worst thing you can do is probably eat a heavy meal, drink alcohol, and then go to shovel snow, because alcohol can actually cause more hypothermia because you feel warm from the alcohol and you don't even realize you're getting hypothermic on the inside. Your skin feels warm, but the insides are actually, you know, not warm. You know, you're not taking care of your symptoms when you have alcohol on board.
Wow. It's almost disguising itself.
It's disguising itself. Plus, all the blood comes to the periphery because the arteries are dilated and you lose your inner heat.
Okay.
And you don't want to eat too much food just before you go do that physical activity. So small bits of work, come back in, warm yourself, go back in, do a little more.
And that can make a huge difference for your
Yes.
overall heart health.
You know, the worst thing you can do is you might think when you're having a heart attack that you pulled a muscle because you were shoveling snow, and we've had cases where people have just taken Advil or Motrin or something like that and taken some Pepto-Bismol or some Pepsid over the counter thinking it's just stomach and muscle pain from shoveling snow when they were actually having a heart attack. So important to keep in mind about symptoms of a heart attack as well.
And you said the next couple of days, and of course anticipating more snow on Friday, you will see the effects of something like this.
Absolutely.
So want to be very careful that we're watching for the signs.
Yes. Right.
And what are those signs that we need to be extra careful of?
I think if you start noticing chest pressure, heaviness, tightness, ache in the back between the shoulder blades, think you might blame off on muscle pull. Please be careful, especially if you have a lot of risk factors for heart disease. You're getting out of breath, that is undue exertion for you. Or women, you know, if they're having more epigastric pain, they're more nauseated, they're more dizzy, short of breath, they could actually be symptoms of a heart attack or heart disease. You may start having a lot of palpitations and pounding.
Okay.
And so please be careful. Remember, you know, when we are in the cold, our blood vessels can actually go into spasm and constrict, and our blood gets a little thick.
Okay.
And if you're out in the cold too much and you're not used to it, you can have a heart attack.
Can cause some big problems.
Yes.
Okay, well definitely take your time doing your shoveling today, Dr. Shoba. Great to have you on the show. Thank you so much for joining us. For more
Thanks.
on the symptoms, you can always check out the website. It is heart.org. Some great, valuable information.